This fall, Alberta Health Services, in partnership with the Calgary Public Library and the University of Calgary, hosted a living library. Cancer experts, researchers, and patients were available as living books to share their knowledge and experiences with the public during the event.
I think this is a fabulous program because I didn't have anybody I could call or talk to ask about cancer, or to ask about what, yes, these are my options, but what do those actually mean? With my type of cancer and my type of reconstruction, there wasn't a lot of information. You go to the internet first because that's your only resource from your home, and it has a lot of stuff that didn't actually pertain to my type of cancer.
The concept of the Living Library was designed to help members of the public find answers and/or support as they deal with the impact of cancer in their lives.
I was diagnosed in 1989 and then recurrence in 92 when there was no internet. There were no sort of easily accessible layperson type books on cancer, which is probably why I became a cancer researcher, because you had to actually go to the library, heavy-duty textbooks and medical texts to learn about it.
Visitors to the library have an opportunity to borrow the living books and to engage in 20-minute conversations. The living books include oncologists, researchers, educators, patients, survivors and family members, professors and medical students.
I have worked for 25 years as an oncology nurse here in the Calgary area, and I've learned a lot about the experience that cancer patients have as they live with their cancer. And then I studied the experience of cancer over many, many years, and I just finished my PhD where I explored the experience of living with cancer as a family. And then my own family member was diagnosed with cancer, and I became a family member of living with cancer. And so that has offered me a very unique experience to share because I can see the experience from all three sides, academically, professionally, and as a family member.
While no specific medical information is given out during the event, the Living Library is a way for members of the public to reach out and connect with individuals in their community that they might not normally have an opportunity to engage with.
A lot quicker than basically trying to search through Google or try to go through the many books and try to find out exactly what you need to know. So it was really helpful.
They're a living, breathing, talking book that gives you that the texture of a conversation that you don't get on the internet. Talking to a live person that's been through it, I think is outstanding.
I think it's a great idea. I think being able to share your experiences, of which I have from several perspectives as a researcher and as a cancer survivor, and I think it just makes it very accessible for people to ask the questions and get the answers to the questions they really want answered.
I currently do testing for the clinical side of cancer, and I wanted to talk to somebody who could maybe inform me or hook me up with doing research more on the front line of cancer at this point. It was excellent. I talked with the scientific director of the Charbonneau Cancer Institute. We talked about credentials that are required to work in his laboratory and pathways to get to be able to do that cancer research.
I think what's the most amazing about the Living Library is that it's an opportunity for everybody to come together with a variety of experiences, and because you never know what piece of knowledge is going to make a difference for someone. And so by creating opportunities like this for people to share a variety of experiences, we may just hit the mark for some people.